Hello everyone, welcome to my YouTube channel Pathology Learning. I am Dr. Monica. In today's class, we will be seeing about tissue repair, which will be the last heading under the inflammation series. So we all had seen how an injury will lead to an inflammation. So after inflammation, what happens? The tissue has to go back to its normal state. So how does this happen? This process by which the tissue is going to restore to its normal architecture and function is going to be termed as tissue repair. So that is what we will be seeing today. So for tissue repair to happen, there will be two processes which are involved. Firstly, the cells which were lost has to be replaced or regenerated. So cell regeneration is the first step. Then secondly, there will be a scar formation. This we all must have experienced when we had a wound, right? So the first step, that is for the cell to regenerate, the cell should be capable of regeneration. So this can happen by two mechanisms. Firstly, the normal parenchyma of the cell, that is the differentiated type of tissue. So that itself will proliferate into a mature tissue. So the differentiated cell itself will proliferate and compensate for the loss of the tissue. So that is one type. Secondly, we have another type, which is the cell regeneration will happen from the tissue stem cells. So most of the cells will have a reserve. So from those tissue stem cells, that is the progenitor cells, new cells can proliferate and come and replace the injured cells. So these two mechanisms will happen for cell regeneration. So cell regeneration can happen only when the supporting structure of the tissue or the organ is intact. So remember, so only when the supporting structures of the organ is intact, regeneration can take place. So for regeneration to happen, let us understand about the type of cells first. So we have three types of cells. So first cell will be a labile cell. Labile in the sense they are capable of division, they are continuously dividing. So cells like the bone marrow, hematopoietic cells, or even the cells in the epithelium or mucosal epithelium of the GIT, skin and genital tracts. So these are all continuously getting denuded and replaced every time. So these cells are going to be called as labile cells. While stable cells are the cells which are capable of division only when there is a stimulus like an injury. So in liver, kidney, so all these places we are going to have these stable cells which can divide when an injury happens. Then the permanent cells are there which are not capable of division in the postnatal life. So examples of these are neurons and cardiac muscle. So these cells, when they are injured also, they cannot be replaced because they are not capable of division. So depending on the type of the cell also, the regeneration will depend upon. Okay. So the second mechanism, that is the scar formation. So scar formation will take place when either the cell is not capable of regeneration like in a permanent cell, or when the supporting structure of the organ, it has been extensively damaged that it cannot further support the regeneration. So scarring has to take place in that case. So scarring will happen when supporting structures are not intact and then cell proliferation is not going to happen. Okay, in this kind the scar formation will occur. So we'll see each of these steps individually now, starting with regeneration. So regeneration, I already told two mechanisms. First mechanism is the differentiated cell is going to proliferate and give rise to new cells. Another thing is progenitor cells. Example, that is from the tissue stem cells it is going to arise. Let us take the example of a liver injury. Okay, so we all know liver is capable of regeneration. It was a kind of stable cell, right? So there will be three phases involved in liver regeneration. The first phase will be the priming phase. Priming phase is the liver has to get primed so that it can become receptive to the growth factor stimulus. So only when growth factors come, the cell will start proliferating. So this stage wherein the cell is going to get ready to proliferate is called as the priming phase. It is going to be induced by an interleukin 6. This interleukin 6 is also going to be produced by the liver cells only, and this interleukin 6 will be the responsible for causing the priming phase. The second phase will be the growth factor phase, wherein multiple growth factors like hepatocyte growth factor and epithelial growth factor. So all of these growth factors will act on the liver, and that will stimulate certain signaling pathways in the cell. So that will trigger the cell to undergo metabolism, so that cell organelles like membrane, cell membrane, cytoplasm, nucleus, all of these structures are going to be formed. That will happen. Then other than that, the cell cycle will also progress. So only when cell cycle progresses, the cell will proliferate, right? So growth factor phase is the one in which cell cycle progression and then cell metabolism is going to take place. The third phase will be the termination phase. That is, the cell has now proliferated, it has to stop proliferating. So with the help of anti-inflammatory cytokines like TGF-beta, signals will be induced and the proliferation of the cell is going to stop. So this is the process which happens for a proliferation of the differentiated cells. Suppose the cell is going to proliferate from a stem cell. Again, we will take the example of a liver. So in liver, the stem cells are going to be called as oval cells. And these oval cells are present in the canals of Hering. So canals of Hering are present and these are going to connect the bile ductules. So in these canals, we also have these oval cells which are the tissue stem cells in a liver. Okay. So now regeneration process is over. Now let me give you an overview as soon as what happens when an injury happens. Suppose you get any injury. So what happens in your body? First thing which will happen is it will cause a platelet plug to form. So that has to stop the bleeding. Any injury, it is going to cause bleeding, right? So for the bleeding to stop, a initial platelet plug will be formed so that it will bridge the gap and stop the bleeding. And over this platelet plug, the further coagulation cascade will activate and the final product of the coagulation cascade, which is the fibrin clot, will form. So this is going to bridge the gap in the first place. And simultaneously, inflammation will happen. So till this, we all know. So inflammation will happen, neutrophils come, they come and clear this offending agent, and then macrophages will come which will clear the debris. So till inflammation, it is all done now. So next what happens? Now the cells has to undergo regeneration. So what all cells undergo regeneration? We saw it will be the epithelial cells, that is the tissue parenchymal cells. Along with that, the endothelial cells, new blood vessels have to form. So only when new blood vessels form, tissue repair can happen. So blood vessels, endothelial cells will proliferate. Other than that, fibroblasts. Fibroblasts are the cells which are responsible for formation of the scar. So all of these cells are going to proliferate. So that step will happen. Then the next step will be the formation of granulation tissue. So granulation tissue is going to be the hallmark of tissue repair. Granulation tissue is nothing but we all must have seen. When you develop any wound, you see some pinkish fleshy material, no? So that is nothing but the granulation tissue. So this stage occurs before the scab formation. Okay, so next time you get a wound, do check it, okay? So that is nothing but the granulation tissue. So this granulation tissue is a composition of these new blood vessels, fibroblasts along with inflammatory cells. So in the previous stage itself, I mentioned endothelial cells and fibroblasts are going to get proliferated, right? So these are going to be part of the granulation tissue. Now this fibroblasts which were proliferating will now produce collagen, connective tissue, and that is the one which is going to be responsible for the scar formation. Okay. So this connective tissue is nothing but collagen which is produced by the fibroblasts, and that is going to form the scar. Now the scar has formed. Now what should happen? The scar has to get trimmed. It will get remodeled basically, okay? And it is going to happen with the help of few enzymes like matrix metalloproteinases. So matrix metalloproteinases are MMPs, and these enzymes usually need zinc as a cofactor, okay? And once this remodeling has happened, this has to stop. So for that we need some enzyme which is again going to inhibit this matrix metalloproteinases. So those enzymes are nothing but TIMs. These are tissue inhibitors of metalloproteinases. So TIMs will inhibit the MMPs. So now the connective tissue or the collagen has been remodeled. Now the final step in the remodeling will be wound contracture. So if the wound is this big, but the scar is not this big, right? So the scar usually is quite thin. So that is because of wound contracture. The collagen, it will then contract and it will form a compact scar. So that process is called as wound contracture. And this is going to happen because of a specific kind of cell called as myofibroblasts, okay? So myofibroblasts are also fibroblasts which have a specific property of a muscle as well. So they behave like muscle and fibroblasts. So muscle has a property of contraction. So these myofibroblasts also have a property of contraction, and that is one which is responsible for causing wound contraction. Okay. So now we'll see in detail about this granulation tissue. Okay. So granulation tissue, as I explained, it is a combination of new blood vessels, that is nothing but neoangiogenesis, along with fibroblasts and inflammatory cells. Okay, this is the definition for granulation tissue. And the inflammatory cells which are component of this granulation tissue will be mainly mononuclear cells, especially macrophages. And what kind of macrophages it will be? Remember, it was M2 macrophages which was responsible for tissue repair. This we saw in the previous video, right? And these M2 macrophages will produce anti-inflammatory cytokines and fibroblastic cytokines like TGF-beta, PDGF, fibroblast growth factor like FGF2. Other than that, interleukin 6 and 10, which were anti-inflammatory cytokines, right? So all of these cytokines are going to be produced by the M2 type of macrophages. So we'll start with the first component of the granulation tissue, which is the new blood vessels. So the formation of new blood vessels is called as neoangiogenesis. For a new blood vessel to form, it is going to sprout from a previously existing blood vessel only. So in this diagram, first diagram, if you appreciate, the endothelial cells are the ones which are lining the insides of the blood vessel, and basement membrane will be there. Then apart from that, outer layers, if it's a capillary, we'll have a pericytic layer, and then if it's a artery or a vein, you are going to have a smooth muscle layer. So when new angiogenesis has to take place, the sprouting of the blood vessel is going to happen, and this is going to be regulated by a very important cytokine, which is VEGF, vascular endothelial growth factor. So VEGF is the most important cytokine which is going to be responsible for neoangiogenesis. For neoangiogenesis to happen, the first step which will happen will be vascular dilatation, and that is going to be mediated by nitric oxide. Then what will happen? The basement membrane will break down and the new sprouting of the blood vessel will take place. So, and when new sprouting takes place, the endothelial cells from the previously existing blood vessel will now go into this newly sprouted blood vessel. So this is going to be directed by FGF2, which is fibroblast growth factor. Then we'll have the remodeling of this newly formed sprouted blood vessel. So the newly formed blood vessel has to form the further layer, that is the pericytic layer or the smooth muscle layer, and this lumen has to form, that is the vessel has to recanalize. So all these steps are going to be regulated by angiopoietins, PDGF and TGF-beta. And this entire sprouting process is going to be regulated by Notch protein. So it is so you just remember all these cytokines, especially VEGF, which is going to be responsible for neoangiogenesis. Next, we'll go on to the second component, which was the fibroblasts. The fibroblasts, as I already mentioned, they are going to lay down in connective tissue material, especially collagen. So the most important MCQ here will be the type of collagen present in granulation tissue. So remember, in granulation tissue, it is going to be both type 1 and type 3 collagen. That too, especially type 3 collagen. And in scar tissue, when it becomes a scar tissue, it is going to be type 1 collagen. Okay, very, very important MCQ. In granulation tissue, we have type 1 and type 3 collagen, while when it is getting replaced by the scar tissue, it is going to be type 1 collagen, because type 1 is the most abundant collagen, and it is also the collagen which has the maximum tensile strength. For a wound to be strong, we need the maximum tensile strength, and that is why a scar tissue is going to have type 1 collagen. Okay, remember it. And another thing was, granulation tissue is the hallmark of tissue repair. So let us see the day-wise events which happen in wound healing. Starting from day 0, that is immediate reaction was platelet plug formation along with fibrin clot formation, right? So platelets and fibrin are going to form the clot. That is going to happen immediately. Then the same day, the neutrophils will get attracted to the site. So inflammation will happen and neutrophils will be invited to the site. So inflammation will be useful for clearing all the debris and the offending agent. Now the second day. In the second day, what will happen? Repair starts to form. So cell regeneration will start. So starting from the epithelium. The epithelium will start to bridge. So a thin layer of epithelium is going to bridge the wound. Then day 3. Here the neutrophils will be replaced by the macrophages. So macrophages are the cells of chronic inflammation, right? So macrophages will take over neutrophils. So when macrophages get inside, what will happen? Repair will start coming up. So early granulation tissue will come up because of M2 macrophages, right? So early granulation tissue will start forming, and in granulation tissue we saw it is going to be blood vessels plus fibroblasts as well, right? So this fibroblast will start to lay down collagen at the peripheries of the wounds. So the margins of the wound will develop collagen now. So all these events will happen on day 3. Then on day 5, there will be the maximum granulation tissue. So when maximum granulation tissue is there will be maximum neoangiogenesis. The collagen which was previously present at the peripheries are now going to bridge the wound, and the epithelium which was regenerating is going to replace, it will become a full thickness epithelium. So the wound is now being closed, okay, the defect is being closed. So maximum granulation tissue, angiogenesis along with full thickness epithelium and collagen bridging will happen on day 5. And on day 21, there is going to be maximum collagen deposition, okay. And on day 28, that is within a month, the scar formation is going to be complete. And if you ask if the scar is going to have the 100% wound strength, that is if it is going to be back to 100% normalcy, no, never. So all these are very important MCQs. The maximum tensile strength a wound will get will be just 70%. It is never going to be 100%. Only 70% of the wound tensile strength will be regained. So all of these day-wise events are very, very important MCQs. So moving on, we'll see about the types of wound healing. So we have two types of wound healing, starting type 1, which is also called as primary or the first intention, then secondary or the second intention. So in primary union, what we have is there will be a surgical incision kind of a clean wound. So the wound will be clean and the edges of the wound are going to be opposed. So there is not going to be any gap. In this kind of injury, the same steps of wound healing will happen. Coming to second intention, this is example of a traumatic injury wherein you have gaped kind of edges. The opposed edges are not there, it is going to be gaped, and we also might have infection. So in this kind of a traumatic injury, you will have the same steps of wound healing only, but there will be large amounts of granulation tissue formation, large amounts of scar tissue formation to bridge the gaped wound, okay. So when this happens, there should be wound contracture as well, so that the scar tissue is reduced in size. So wound contracture is a very important feature of secondary union. So what are the factors which are going to affect wound healing? Starting from local factors. So any infection is there at the local site, then the wound will not heal, okay. The most important cause of delayed wound healing is infection. Other than that, the nutrition status of the patient. Example, vitamin C deficiency. So vitamin C is the one which is responsible for collagen formation. So if collagen is not there, obviously scar is not going to form and the wound will be defective. The scar formation will be defective. Then other than that, diabetes, healing of the wound will delay. Glucocorticoids, again here the cytokine productions will be altered and here wound healing will be delayed. Then we also have the poor perfusion. If the oxygen is not there, neoangiogenesis is not there, the wound is not going to heal. So poor perfusion is again a cause of delayed wound healing. Then we'll have the type and location of the injury. So the type of cell which was injured. We spoke, no, labile cells, stable cells. So what kind of cells are being injured? What kind of injury? The primary union, secondary union, what kind of injury is going to happen? And the extent of the injury. Is it mild? Is it severe? So all of these factors are going to contribute to the wound healing. So now we had seen about normal wound healing. So now we'll see about the abnormalities which can happen in wound healing. So starting with exuberant granulation tissue, which is also called as proud flesh. So here the granulation tissue is going to be produced in excess and above the level of the skin. So here is the level of the wound, but here it is going to protrude above the skin. And so when this granulation tissue is protruding above it, the epithelium cannot regenerate over it. So this is going to cause in defective wound healing. In order to correct this, you will have to remove this proud flesh and level it to the skin surface. Only then the epithelium can cover this granulation tissue and repair can get completed. The second abnormality will be a hypertrophic scar. So the exact opposite of it will be a keloid scar. We all must have seen both of these conditions. Hypertrophic scar is a scar which will develop within a month's time usually. So within a month's time, what will happen is there will be excessive amount of this collagen or scar production and scar formation, but still scar formation is limited to the edges of the wound only. Okay, and it has a property to regress. So within a year, it will regress and go back to normalcy. So this kind of a scar is called as hypertrophic scar. While keloid is a genetic tendency usually seen in African American origin people, and here you must have commonly seen it in the ear lobules or even in the sternum and trunk, so or even in the shoulders. So after any injury, the collagen which gets deposited on scar formation which forms will exceed the margins of the skin. So it will go beyond the margins of the skin and it will protrude above the surface. So this is the classical image of a keloid, and the most important thing about keloid is it is not resolving. Okay, it can happen anytime within a year or even within 6 months of the initial injury, but it will not regress. And the most important thing about keloid is if you remove it, suppose if you are excising it, again it is a type of injury only. So it will again cause a keloid formation. So the treatment for keloid is actually injecting steroids. So intralesional steroids are given and that is going to cause reduced scar formation. Okay, so that is the treatment for keloid rather than an excision. The fourth type will be a contracture. So we all must have seen burn patients wherein the wound contracture will cause deformity. So here the excess of this wound contracture procedure is going to happen and that is going to cause deformity. So in today's class, we had seen about the various events which happen in tissue repair, starting from cell regeneration to scar formation, and the day-wise events which happen in this. So the day-wise events are very, very important. Then finally, we saw about the abnormalities in tissue repair. So this is the last video in the inflammation series. See you in the next series. If you like my content, consider subscribing and sharing it to your friends who might also benefit from my video. Thank you.